depression and suicidal ideation. Sadly, a very dangerous disorder in our emergency department. These are patients who come in with a depressed mood and anhedonia. You walk in the room and you can just feel yourself feeling a bit sad yourself. The mnemonic Ziggy Caps is classically used to remember some of the signs and symptoms of depression and risk of suicidality. This includes a disruption in sleep, a lack of interest, a sense of guilt, a lack of energy, lack of concentration, poor appetite, decreased psychomotor movement or vegetative symptoms. These patients sometimes just don't move, and certainly a risk of suicide. When evaluating these patients, you want to identify risk factors for suicide. This can include prior attempts, male sex, which is strongly associated with risk of use of firearms, a much more lethal means and much more successful outcome for some patients, hopelessness, substance abuse, and as we talked about, access to lethal means. Management of patients with depression and suicidality generally involves inpatient admission. Also, long-term, they can benefit from medications such as SSRIs and SSNRIs, much more commonly used than older TCAs and MAOIs.